we'll find there's no need to cry. In this place could be much brighter than tomorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Be the one, make it a better place for you and for me and the entire human race. There are people dying if you care enough for the living. Make a better place for you and for me.
And it would be even more meaningful if now all the speakers who participated in the Incheon Declaration come up to the stage and join the event with the choir singing for the healing of the world. So please come up onto the stage. And in the meantime, I'm going to introduce who is going to join us for this special moment as our esteemed participants get on the stage along with the choir. 네, 인천 선언문에 함께 해주신 모든 분들께서 지금 무대로 올라와 주시면 되겠습니다. So for the declaration, we are being joined by Kim In-mi, President of Ewha Women's University, who's also the chair of the organizing committee of the World Health City Forum. And also Stefania A. Cormier, Weiner Endowed Chair and Professor of Louisiana State University. And we're also joined by Im Taek, Gwangju Donggu Mayor, the chair of Korea Health Cities Partnership, who are the representatives for the declaration. And also in this Incheon Declaration, 3 first-grade elementary students will be joining us. These students are participating in the Children's Environmental Health Birth Cohort, organized by the Ministry of Environment of the Republic of Korea to conduct long-term tracking studies on the causal relationship between environmental hazardous substances and children's health. In other words, the bodies of these children are accumulating records of the interactions between humanity, the environment, and the earth. The Incheon Declaration represents the commitment and promise of adults for the healthy future of these children. So, ladies and gentlemen, as they are coming up onto the stage, now please welcome the children and the speakers with a big round of applause. And now please announce the declaration.
The Incheon Declaration, Cities for Health. The world's population is increasingly urbanized. Cities are growing. This provides opportunities to create urban environments that support health and well-being. City leaders, communities, and citizens have the opportunity to apply new knowledge about social, psychological, and environmental determinants of health and to leverage new technologies. The growth of cities globally provides opportunities to reach an unprecedented number of people, helping them achieve better health outcomes for happy, fulfilled lives. As most future urban growth will take place in developing countries, the world today has a unique opportunity to guide urbanization and other major urban development trends in a way that protects and promotes health. This is important, not least because the health and well-being of citizens is perhaps a city's most important asset. However, the growth of cities also brings risks. The rising non-communicable disease burden, the persistent threat of infectious disease outbreaks, and an increased risk of violence and injuries are key public health concerns in urban areas. Pollution, social isolation, in particular for the aging population, substance abuse, mental illness, and other risks may accompany unmanaged urbanization. These health burdens fall especially on the urban poor, including those in informal settlements, poorly planned environments, or low quality accommodation. While urbanization has led to improved average health outcomes, rising inequalities have allowed serious disease to persist. We, the signatories to this declaration, believe that deliberate strategic action is necessary to capture the opportunities of the growing urbanization of the world's population and to turn the tide of growing inequality so that inequalities fall as cities grow. We believe that cities can be part of the solution to global health challenges. Investments in health-based urban and territorial planning secure long-term health and well-being legacies for a growing proportion of humans. Smart technologies can be deployed in hitherto unimagined ways to reduce infectious disease risks, improve air quality, evaluate individual risk factors, manage stocks and flows of resources such as water and energy, and for other as yet unconceived risk purposes. Cities are complex systems providing the opportunity to go beyond the concept of health and well-being as solely an individual level concern and treat health issues holistically across different sectors and scales of intervention. Human and environmental health can be fully integrated into the planning and development of energy, transportation, housing, agriculture, commercial, educational, and entertainment sectors. As cities grow, it becomes possible to address growing disparities and the unequal access to vital resources necessary for health and well-being. The transformation will require innovative leveraging of technology, creative financing, generating and working with evidence and positive collective action to envision and build just, sustainable, resilient, and people-centric urban futures. Its success will depend on strong leadership of city governments, partnerships, community engagement, and participatory approaches. We call on academia, civil society, national and local governments, private sectors, and international organizations to commit to the following principles, goals, and actions. Incheon principles. Cities should develop according to the following principles. 1. Health, equity, fairness, and social justice in health opportunities and healthcare provision. 2. Participatory governance for inclusive health, safety, and resilience. 3. Ecological, low-carbon sustainability in urban environments. 4. Disaster resilience and preparedness for multimodal adverse events. 5. Harnessing data-driven intelligence for smart, healthy cities. 6. Share information, data, and experiences with other cities.
Incheon action.
Actions. Leaders at all levels, communities and citizens should take the following actions. 1. Establish health equity indicators and commit to time-indexed goals. 2. Develop and publish participatory governance mechanisms in relation to health for city inhabitants, regardless of official, legal, or immigratory status. 3. Establish and publish sustainability plans for energy, food, water, medical, and other needs. 4. Establish and publish plans for multimodal disasters covering pandemics, heat waves, floods, earthquakes, blackout, water shortage, food shortage, and or other contextually relevant risks, including combinations thereof. 5. Digital health strategies. 6. Establish and participate in open data and narrative sharing platforms. The Incheon Declaration is our call to action, heralding a renewed commitment to global health risk prevention, management, and preparedness through the opportunities presented by urbanization.
With that, the Incheon Declaration has been announced. Let's give them a big round of applause. Thank you. And now we will proceed with signing the declaration. So we will have President Kim In-mi, Professor Stefania Cormier, and Mayor Im Taek to sign as representatives of the forum's participants. So please sign the declaration. All right, let's give them a big round of applause. May the Incheon Declaration become a meaningful milestone for humanity and all living beings living together on Earth to create a sustainable future. So let us all join in signing the Incheon Declaration with a big round of applause.
Make a better place for you and for me. Lead the war, make it a better place for you and for me and the entire human
And with
race.
that, the Incheon Declaration has been signed.
If you care enough for the living, make a better place for you and for
Thank you very much. And now to commemorate the successful hosting of the first World Health City Forum and to celebrate the Incheon Declaration, I'd like to ask Incheon Metropolitan City Mayor Yoo Jung-bok, who is also the chairman of the forum, and the organizing committee members to come up to the stage for a group photo. 네, 1회 포럼의 성공적인 개최와 또 인천 선언을 기념하기 위해서 유정복 대회장을 비롯한 조직위원들도 무대 위로 올라와 주셔서 다 함께 기념 촬영을 하도록 하겠습니다. So please come up onto the stage. All right, it looks we have everyone for the photo on the stage. So please look at the front, at the camera. 우리 아이들이 다 보일까요? All right, let's all smile into the camera together. How about I say World Health and you say City. 제가 월드 헬스 하면 시티 하면서 환한 미소 지어주시면 되겠습니다. 월드 헬스 시티. And this time let's applaud together. 이번에 다 함께 박수를 치면서 기념 촬영 마무리하도록 하겠습니다. Let's clap together. Let's applause. 네, 무대 위에 계신 분들 모두 함께 힘찬 박수로 마무리하도록 하겠습니다. Let's end with a big round of applause. Everyone on the stage for the last photo. Okay, thank you very much. You may leave the stage. 네, 감사합니다. 이제 모두 자리로 돌아가 주시면 되겠습니다. Thank you very much. You may leave the stage. So with that, the Incheon Declaration has now been concluded. Thank you to all of our participants. And we would also like to give a huge round of applause to the Incheon Wizard Children's Choir who provided beautiful harmony for the Incheon Declaration.